Welcome to Self-Manage and Self-Treat Your Knee Pain. You will be given strategies, tips, and exercises that you can use before injections or surgery or after injections or surgery. Just need to get a couple things out of the way here. This is a copyrighted presentation. And it's based on this book, Self-Manage Knee Pain, which I wrote and have been revising. And it is now in its complete state in 2022. If you have any significant health issues that would prevent you from doing some of these exercises, just consider the exercises, and if you need guidance, talk to your medical doctor. You could also talk to a physical therapist if you have specific medical issues, or you're not sure if you should try any particular exercise that will be outlined later in the program. My name is Ron Clinton. I'm a PT, a physical therapist, and I've got a master's in education, and I'm certified in the McKenzie method of physical therapy. My company's name is Back Coaching Services, and the website is backcoachingservices.com. The vision statement for my company is to be a force for transforming society by helping clients optimize movement one person at a time. And over the last 20-some years, I've been in private practice seeing patients one-on-one for usually about 45 minutes per session. And this course is going to be like that for you. You are my patient right now. And I have tried to include as much information as I would give any patient who came into me with knee pain. The mission statement for this video is to serve and empower people with knee pain by globally sending knowledge to people all over the world to help them help themselves self-manage and self-treat their knee pain. The first objective of this video, you will be provided with research-based information to help you become a better decision maker regarding your knee pain. This is extremely important because you can be talked into doing various things that might not be the best for you. You will learn how to self-assess your knee to determine what activities to do more of and what to do less of. And you will assess your knee to determine if you have a directional preference for knee exercise. And this is a very good sign for the potential to lessen symptoms and improve function. You will be provided with exercise guidelines and be shown exercises that many knee clients have found beneficial. This program is based on solid research from multiple published worldwide guidelines for the conservative care of knee pain, utilizing primarily self-management strategies. So many past clients have had very good outcomes with this type of program. They have demonstrated the following: increased confidence in managing or controlling their symptoms rather than being managed by them. Increased self-esteem when their pain is lessened or eliminated. They feel much better about themselves and can get back to their regular activities. They've had reduced or eliminated strong medications with dangerous side effects. And they've learned skills that have made them independent of practitioners, using them only as consultants. Another benefit is preventing strength and muscle mass loss due to decreased activity, which is secondary to the knee pain. And they've been able to break the cycle of inactivity that results in slowed down metabolism and weight gain. And they've become a highly knowledgeable consumer of medical services related to knee pain. They've also saved money by avoiding aggressively advertised and very costly treatments with little research to support them. Now, if you've had knee pain for a long time and maybe a certain number of episodes and ups and downs, maybe injections, maybe surgery, think of this course as a college course that you would need to get an A in. Take some notes on key points. Take action on those key points. Mainly take your time going through this program. Your program will be unique. Every patient I see has some differences in their program because they are a unique individual. This is going to be a tremendous benefit from this program. Strategies, tips, and exercises as medications. What do I mean by that? Well, medications can reduce your symptoms and improve function. And health management skills and exercises can do the same. So we like to say, make movement your medicine without the side effects. Now, every patient that comes to me has a unique solution to their problem. I call it the jigsaw puzzle solution. Typically, one exercise or one strategy isn't the complete answer for most clients. One client may have 6 to 8 things to be addressed, and another client may have just a couple, 2 or 3. Everyone has a unique solution. So we're going to be building your self-management toolkit. Now, just a bunch of knowledge without action is not going to help you very much. If you just whip through these slides and don't take notes and don't take actions, you're not going to have as much help as you could get. You need to try everything out and evaluate it. And I've given you the tools to do that, and you will see those coming up. And consistently use what you have learned that is helpful. You have to implement the tools. Now just work through one section at a time. Try the tips, strategies, or exercises before moving on to the next section. Keep a checklist of the things that are really helping you and refer to it daily as a reminder to use them. So these would be highlights from the course. Key points that you definitely want to implement, and having a little checklist will keep them top of mind. Now, it's possible at the end of the course that you may need assistance to get the maximum benefit from this course. Physical therapists are movement specialists. A consultation with a PT may help you put it all together. There are certain exercises that can be introduced, and they may give you significant benefits, but maybe not 100% removal of discomfort and return to complete normal function. You may need to go to a therapist to finalize the deal. I want to talk a little bit about the organization of the modules. First of all, please work through each section before going on to the next. And at the end of the section, you could review it a little bit and please write down what you're going to work on. And now I'm going to give you just a little overview of the different modules that you'll be going through. The first one is the knee pain vicious cycle. A cycle that's kind of hard to get out of, but with the strategies and techniques you're going to learn, you will get a lot of help with that. Second module is called, the name of the game is self-management, because this is the first choice. This is what the literature suggests. Third module, limitations of X-rays and MRIs. You will be quite amazed when you hear the information in this section about the limitations of X-rays and MRIs. In module 4, the same thing with medications. And in module 5, we'll talk about inflammation and self-management. This is something that is getting a lot of research in recent years, the effect of inflammation that especially can come from diet and overweight. Module 6, we'll talk about the knee pain vicious cycle and how to break it. Module 7, different self-management interventions. In Module 8, you'll learn principles for managing daily activities. These are lifestyle modification activities. In number 9, we will do an assessment to see if we can determine if the spine is having an effect on your knee. And this could be very dramatic if we do identify this. 10th module will be self-assessing your knee. And module 11 will identify directional preference exercises if you have identified you have a directional preference. In module 12, we'll be giving guidelines for exercise. In module 13, additional lower extremity strengthening exercises. Module 14, walking strategies. Module 15, additional exercises. And in module 16, we'll discuss again professional guidance for self-management. In number 17, a summary and action plan. So let's talk about this knee pain vicious cycle. When you have pain, you're not as active as you were. If the pain is caused by inflammation, irritation, or aggravation, it's going to limit activity. You take less steps per day, you have slower metabolism, and more likely weight gain. Some of the consequences of chronic pain: progressive increase in medications are needed, slower walking, less walking, possible limping. And if you have that, it puts more pressure on the other knee or the low back. Consequences of inactivity: you lose muscle strength, you lose muscle mass, you can lose balance, and there can be an increased risk of falling. Self-management skill building starts this process of reversing the vicious cycle as you build your personal toolkit. Knowledge and understanding. It's so important that we have research-based information, but it must be actively used and applied. And that's the key to breaking the cycle. I'd like you to just review now for a few minutes what we've gone over so far and think about what we've talked about and take some notes. Get yourself mentally prepped to work on this program, and then we'll go on to this next section.